Happy to be here. And I know that I have no time, only 10 minutes, yes. And when I decided to talk about this topic, it was because it is very, very important, and it is interested in also for students, for teachers now. And we made a little presentation in Ukraine about on this topic, and also in Italy in Pisa University, and that's why I decided to talk about in Miskolc about this. And I need to say that the human crisis that is fast becoming a human right crisis because of these measures of governments in to fight the Covid-19, and everybody knows that 87 states both authoritarian and established democracy, and every state was declared the state of emergency. In Ukraine, we have the Article 14 and Part 2 of Article 78 of the Civil Protection Code we have in Ukraine, and it was established the state of emergency for single state system or civil protection through Ukraine from 2020, from March till April 2021 of this disease of COVID-19. And the freedom of expression, the right of assembly and privacy was particularly concerned of the violations. And I need to talk that it is interesting, but we are talking about the COVID-19. It is about the, as say, the International Press Institute. It is that we had 400 media freedom violation. It is since 5 February 2020 and 626 in 2021. You know, it was started with the China. Everybody knows this situation. In December, we heard about this Chinese doctor, Li Yanling. He said that it will be catastrophe in the world, and everybody, he was trying to warn about this virus in COVID-19. And the next step, was interesting because Viktor Orban, I don't know, is it this work, because when he was ruling the decrease in the declaration of the state of emergency, and the government announced an amendment of the criminal code making anything the government deems fake news, it's punishable for 5 years in Hungary. And it was really interesting because we studied this case in Ukraine, and that no that this risk posed to the processing of data and steering personal information, and the use of government apps passes a number of concerns when it comes to the right to the privacy. So global this situation was for a violation of rights, people rights. In Ukraine, it was the main violation is the freedom of movement, because everybody was talking that it is impossible. We need to go to the shop, we need to go to run, and to travel to another city. And this was, we applied to the Constitutional Court, and the Constitutional Court said that it is the violation of right to moving, but this is the disease of COVID-19, it is not punishable. But after that, we have a Code Ukraine of Administrative Offense, and the Verkhovna Rada, it's a Ukrainian parliament, amended the Article 44.3. This is called, like you see, violation of rights of quarantine of people, and we have we have that violation of rules of quarantine of people, sanitary and hygienic, sanitary and anti-epidemic rules, and not provided by the law of Ukraine. We have the law of Ukraine of health. It is the Ukraine health law, and it was punished the people from 1 to 2,000 non-taxable minimum incomes, and from 2 or 10,000 non-taxable minimum incomes. It is €4. One non-found taxable minimum income, it's €4. You can understand what was the punishment in Ukraine during this COVID-19. the factories or the entities, they paid from 17,000 hryvnia to 54,000 hryvnia. It is a lot. It is more than, for example, 40,000 hryvnia. It's 1,000 euros now. So it is not for our country. It was not less money. When in March, as everybody says, that in March 11th, 2020, it was declared the COVID-19 pandemic, the Verkhovna Rada was adopted a number of legislative acts, and it is interesting that they provide, as you see, exemption from import of VAT and customs duties for certain medicines, medical devices, a special procurement mechanism for certain goods and services, the validity period of registration certificates for medical products, and the significant simplification of the admission of the market of certain medical products and means of personal protection. So no taxes to these all products which consist of with COVID-19. And then the next, what in our country we did with our parliament, that we adopted the MIA, Managed Entry Agreements. It was adopted in Law of Health in one article, 79, and it was adopted in 2021. So it is very popular in Great Britain, this agreement, and it is give possibility to not make a license, so you can use non-licensed products to cure the patients. And so your patients of COVID-19, they can receive new treatments without any, no, I don't know, maybe any checking these products on the level state. When we are talking about, so this is the main what we did in Ukraine, and when we are talking about the artificial intelligence (AI), everybody knows this is the machine that is doing tasks. They are doing learning and solving problems. And they can do this artificial AI, I will be talk. We can divide it into physical and virtual fields. It is here. And physical field, it is robotics. So you can, maybe somebody saw that surgical navigation system, machines, they ensure to mobility and rehabilitation person. And virtual industry, this is when we have, for example, a watch, smartwatch, and the smartwatch is looking at your heart, about how you feel, and that all. When we are talking about artificial intelligence, so I need to notice that in European Union we have two acts now, because it was in 16 February 2017. It is a resolution of the European Parliament that they recommended creating special legal status for the robots in the long run, and all autonomous works could have the status of electronic persons, and they can be the consumers can have a responsibility for it. And all AI techniques can present a clear picture of recovery rates, affordability and accessibility of healthcare, and identify gaps. Then the next, it is, as you see, on April 21, 2021, the European Commission published their long-awaited proposal for regulation on AI, and it was called White Paper on Artificial Intelligence. I think you heard about it. And the main aim of this to protect the fundamental rights of people and businesses, while at the same time encouraging AI innovation across the European Union. And the last law resolution was adopted, as you see, on 3 May 2022, and it is a big, long resolution, and the main point that you need to use artificial intelligence in European Union in digital age. So, and they are talking about the health here, about the business, about the entities, that everybody needs to use this in all European countries. When we are talking about the artificial intelligence, oh, sorry. So, the first program was IBM Watson Health program of healthcare, and it was a revolutionary program, and it gives opportunity to address medical diagnosis and treatments. And it has a IBM Watson Health program. It is working till now, 2022, and it will help physicians navigate a complex set of patient symptoms and laboratory data, imaging results to compile a set of most likely clinical diagnosis and treatment options. The very important features of this software prototype that you can see the ability to provide several possible diagnoses and treatment options with relative levels of reliability, and the ability to track the information used to make a recommendation. In 2017, it was interesting, very interesting. Program, it's called Mandy, was created. It's a chat robot. You can find this in YouTube, and you are talking with Mandy, and she helps to have a good psychological nature. I don't know, psychological status, good psychological status for this. And it is application for patients who has a disease with some psychological has a disease in psychological field. So Mandy, she analyzes mechanisms for understanding patient symptom descriptions, compare symptoms and causes to determine possible causes, and question generated to display additional interview questions. It was interesting. Also, we are talking in future in this personalized medicine. It is very interesting because the doctor says that the current medicine, you have one treatment fits to all, so you give pills, and for example, we have 5 people, and this pill is good only for 1 or for 2 persons, and for another it is not help. So when we are talking of future medicine, when we are talking about personal medicine with helping of AI, you can see that AI will choose what medicines will be better for the person, for the patient, in such different cases. The next, it is when of COVID-19, was interesting that we have all kinds of tracking apps, and as you see, it is, for example, I don't know, it was very popular in America and in Shanghai, in China. Scientists are working in institute about AI to find ill person with COVID-19, to see do they have fear or no, smell, taste, loss of taste, dry eyes, and that's all. And all these robots of AI also they detect these persons and reports to the institution. And after the patient has scanned with AI, and also their ID card, you've heard about it, that police came to the house of these persons and put them to the quarantine. As you see, what system we have? The most that AI, we need to use it in telemedicine, because I think telemedicine today can be the most, I think, more necessary to help patients in the hospitals. Then we have this also test psychologist who is teaching AI test, who is helping to reduce symptoms of ill people with mental health. And it was interesting when I was showing for students this test, and every doctor said that it is very interesting to also to talk with this test, because she helps to have a good mood for all the day. And when the face of this global epidemic of COVID-19, AE, can help to recognize patient with COVID, then to make chatbots to use AI as a chatbot to consolations, and have a therapy and make a decisions, and have to give a prescriptions. What is I show you all possibility of AI. This is the, for example, yes, you see the first question. It is in China. This is the diagnosis of the virus is in infravision, they calling. You see how it is Ukraine. It is Alibaba was developed this in infravision in China, and this is diagnosing the virus, and as you see, 96%. The next, it is why it is the which in White House you see in 2020 started a project cooperation with IT companies, and to research the coronavirus availability of developers of AI and their algorithms. And the next, for example, it is a British startup, Excita. It is the first company to introduce a drug molecule developed using AI algorithms for human testing. And it was just 12 months to develop, and compared 4 and 5 years for traditional researchers. So it was Andrew Hopkins. He is a lead of artificial intelligence they used. And he said that it can help rapidly develop antibodies and vaccines against COVID-19 virus, find existing drugs to see if they can be used to treat the virus, develop drugs to fight current and future outbreaks of the disease, and that's all. Next, it is the next, it's a benevolent, the same startup, and with against COVID-19. It's reverse vaccinology and machine learning platform, which relied on the supervised classification models. And next, it is a health code in China. As you see, it is a system. There's a facial recognition. You saw it on the TV that you are going on the airport, and everybody, all your faces are recognizing, and they are can fever recognize. Do you have or not? A robot dog, about it is the next. Boston Dynamics has taken up monitoring how quarantine rules are being followed in Singapore. It was this robot, and he was walking on the streets of Singapore and sending messages, reminding visitors to social distance, to stay away from each other, and that's all. And then we have the next pages. It is about researchers. Of AI, they tried to, in mathematical model, predicted with almost 80% accuracy the probability that person will have COVID-19 in their agenda. The next, it is in the United Kingdom was and King's College London. They developed an AI program. They can predict whether a person has COVID-19. And over 3 million people around the world have downloaded this COVID symptom study. The next, it is interesting that Spain and China, the police began to use drones and patrol cities and transmit voice messages urging people to stay at home. I know that in Italy they don't use drones. Yes, you don't? So, and it is urging people to stay at home, special bracelets that track the location. I think that this is the most violation of rights, of people's rights, what we are talking, what I am talking about now, because you understand, freedom is when you can decide what you have. You can choose. This is the freedom. And when the government made these measures, I think this is the violation of people's rights. I understand that, for example, we can talk about the Danish countries. They did nothing. So die people. No measures, no, I don't know, no, and they said that they cannot give that made a violation of people's rights. Then USA, the thermal imaging cameras, they detected in time with help of AI, and using in Hangzhou, in China, AI with a camera recognized the face of person and was walking in an infected area, and they police come and they have remained in self-isolation. What is the benefits of AI, for example, in medicine? Reduces mortality. Everybody says that AI will help reduces mortality because they can more positive effect gives to quality of care. And so the next is reduces the dependence of patients on the level of development of social services, because AI in medicine is to allow robots to care for some patients. For example, it's Alzheimer. We have AI who are working with patients with Alzheimer. This is the person who has forgotten everything, yes, and to improve their quality of life, reduce their independence. Then reduces the number of medical errors. Why? Because more than 18 patients a week, doctor cannot provide everyone with the same amount of attention. That doctor made a mistake, and when we will use the AI in this case, so will be reduces of number of medical medical errors. The next, it is reduces medical cost, because being able to transmit data online, the patient does not need to be hospitalized. They doesn't goes to the to have a right to the hospital. And the strengths or the direction of invasive surgery, because surgical robotic is a tool that provides doctors with accuracy, comfort, and excellent visualization. And positive and negative aspects of AI. So it is that research, for example, it is power of machine learning algorithms, and the technological advances contribute to the development of modern solutions to improve healthcare. Then we have this black box in AI that we cannot know what will be the next decision of AI. This is the black box of artificial intelligence. And the doctrinal, the possibility of recognizing the AI system. Near future, the robot AI will be considered as an object of law, because it is the question, is it a subject of law? It is the object of law. In Italy, because I was asking this, everybody says that it is an object. Because they have no responsibility, only the consumer can have the responsibility of that. But I think that in near future, it will be a subject of law. For example, as I talk about, as I imagine this, you buy a robot for you, and this robot is with you all the day, like a cat, like a dog, and helps you. But in the next future, they can earn money by, for example, with bitcoins. And if they have this Bitcoin, he can take a responsibility for such, I don't know, for such a moment. I think it will be in the future, because as you know, everybody is in these platforms and earn money in Ethereum, Bitcoin, and that's why I think in the next future, maybe in long-term perspective, we can talk that AI will be a subject of civil. I am talking about the civil responsibility, about the compensations, not about the criminal. Okay, so I think that I will finish my because we can divide it. We can divide it the essential into 4 parts of risk of AI. The first is AI system considered as a clear threat to the safety, livelihoods, and rights of people are generally prohibited. High risk AI system identified as a high risk are permitted, but subject to special requirements and conformity assessments. And limited risk, A system with limited risk are generally permitted, but also have a full for specific transparency obligations. And minimal risk, the vast majority of A systems, such as video games, spam filters, fall into the category and are legally allowed as they are minimal risk or no risk at all. Conclusions, only the one conclusion that everybody will be changed in the next future, as everybody understand, because of the risk of the virus, of the health, to sacrifice people, and citizen will suffer in the violation of rights, I think, every day, because of these viruses, of the wars, and of maybe this artificial intelligence will help to survive, because we will talk not with the people but with these systems. Okay, that's all. Thank you very much.